Hello, I'm Dr. Graciela Wetzler, Director of Pediatric Gastroenterology and Nutrition at Maimonides Medical Center. I'm board certified in Pediatric Gastroenterology and Nutrition. My medical training has been pediatrics and pediatric gastroenterology. Originally, I trained in Argentina, where I am from. But I moved to New York more than 20 years ago, and I trained in pediatrics at the Albert Einstein College of Medicine. And then I continued my training into the field of pediatric gastroenterology at the New York Hospital Cornell Medical Center. I chose pediatric gastroenterology because I was always fascinated about the digestive system. During medical school, I was an instructor. I was a teacher in physiology in the digestive system. And I was fascinated to see how food gets into your body. It gets transformed into calories. And then I was fascinated to see what happens when you don't need that food. Where does it go? And I was interested in the disorders associated to that process. What could go wrong? And for example, celiac disease, which is an allergy to gluten, people don't digest that protein well that is in wheat and rye and barley, and as a result, they get into trouble. Or lactose intolerance, which is a sugar in the milk that can give you also problems. So I was always interested in early ages during my medical school into the digestive system and the conditions associated to it. I'm also interested in technology. And the field of pediatric gastroenterology and nutrition uses a lot of technology. We perform procedures in children. We use upper scopes and lower scopes and video capsule endoscopy, and I'm also fascinated by that. So I can combine my clinical skills with technology. To me, that was the equivalent of performing pediatric gastroenterology and nutrition. In my field, I'm interested in gastroesophageal reflux disease. Gastroesophageal reflux disease is well known as GERD, G-E-R-D. What that is the acid that is present in the stomach is coming all the way up to your throat, and as a result, a lot of trouble could happen. I'm interested in gastroesophageal reflux disease in babies. It's very interesting. People don't recognize that babies can have GERD. Even pediatricians don't recognize that the babies can have GERD. These babies are crying all the time. They are refusing to eat. They have hiccups. They have arching. They have coughing. And it's hard to know what is going on with those babies, but the truth is that they have gastroesophageal reflux disease. My treatment philosophy is to listen to the patient carefully. When I see a child and his family, I spend a lot of time talking about what's going on, gathering the data, examining the child, and trying to find out what's wrong with that child. The current trends in pediatric gastroenterology is to use new technology. How can we make a diagnosis without being too invasive or too aggressive, for another word that we use? We have now new equipment, for example, a video capsule endoscopy, which is the child has to swallow a capsule. Obviously, it has to be a child and adolescent who can swallow capsules. But that capsule will travel through your system and take pictures going to a beeper for 8 hours, and you will be able to determine what's wrong with that child without having a needle or without having sedation or without going through a painful process. So right now we're trying to identify new modalities to make a diagnosis without being too aggressive or too invasive. What has changed my practice is the presence of new drugs. We know that drugs, talking about medications, in children are very difficult to be used. They're well known in the adult medicine. They're well known in the adult gastroenterology. There are clinical trials that have been done and proven that are safe and effective, but we don't have those clinical trials performed in children. But now we are doing them. In fact, Maimonides here at Maimonides Medical Center, I was part of those clinical trials, and under my supervision, we did a clinical trial with one of those drugs, and we proved that it was safe and effective, and it has been approved by the FDA to be used in children. And now that medication is available to pediatricians, available to the patients, more importantly, to make them feel better. When a patient comes to me, I want to let them know that I'm absolutely dedicated to the patients. I listen to them. I will listen to the family. I will make everything possible to find out what's wrong with that patient. And if I don't know that, somebody else will. But I'm a very dedicated physician with a very personalized style. And I think that I give myself 100% to each patient, and I think they know that and they feel that. One of my achievements in my career, it was related not to the care of children, but to the care of a gorilla. I've been taking care of children all my life, but one day I was called by a famous zoo, and I was requested a consult to treat a baby gorilla. And I found myself treating a baby gorilla as I would treat any child, doing an endoscopy in a baby gorilla. And it was very rewarding to know that I could help somebody. So it was a lot of fun. This baby gorilla now is healthy, and we did exactly what we would do with a child. And suddenly now I'm taking care of a gorilla, not just children. Besides of course, the reward that I get every day taking care of my patients.